Health authorities around the world have been deployed to tackle COVID-19. However, there are other conditions that are receiving less attention than they should. One of these is HIV. A newly released UNAIDS report shows that coronavirus has derailed UN targets and overall responses. Aisha Abdool Karim is from the Bhekisisa Centre for Health Journalism. She joins us now live for more on the story. It certainly isn't good news coming out of UNAIDS, Aisha, about how we're simply not going to be meeting the 2020 targets that have been set, which means that the 2030 eradication of HIV becomes an even more far-long dream. What has impacted on the services in terms of HIV-related diseases?
Yeah, so I think globally what we've seen is a pattern where the response to COVID-19 has often resulted in resources being taken away from other health programs. In South Africa, what we saw very early on in the outbreak, going back to like March when we first started to see increasing cases, was that traces were taken from HIV and TB programs and were used to assist in the COVID-19 response. We also saw that in trying to increase our testing capacity for COVID-19, there was a reduction in the number of HIV and TB tests being done by labs. Additionally, we had these problems with when we were in stricter levels of lockdown. So if we're talking like level 5 and level 4, it was much more difficult for people to access healthcare facilities and clinics. And additionally, there's this fear with people where they're worried about getting infected, and so there was a large amount of people that were just not going to access their healthcare services and stopped going to clinics because they were so worried about being in these facilities. So, and it's highly likely as we start to see more COVID-19 cases over the coming months, and we know that there's a very high chance that the healthcare system is going to be a reduction in the capacity for hospitals to continue providing care to people with HIV and other health conditions that need regular care. So all of these things together have contributed to the setback that UNAIDS has noted we're going to see in our HIV and AIDS response going forward.
Aisha, is there a way in which countries can be streamlining their response to both pandemics?
Yeah, so I think, again, there's a lot of challenges. I think a big challenge which the World Health Organization has noted is a lack of access to antiretrovirals. So they found that 24 countries had reported critical shortages of HIV treatment. And why that's a problem is that the 24 countries that reported the shortage also happen to represent a third of all people who are taking HIV treatment globally. And one of the biggest factors that cause that antiretroviral shortage or is disrupting that supply chain is that a lot of people were unable to deliver medication, and travel has been severely restricted as a result of the COVID-19 pandemic globally. That's something that we've seen. And because there isn't a cure for HIV, ARVs are an essential part of our response in terms of managing the virus and reducing transmission of HIV. So that's why it becomes more important to implement policies and ensure that people are having regular access to their treatment. So one way of doing that is to do multi-month dispensing medication for several months in a row, so that there's less need for people to come into clinics regularly. And it's especially important for HIV treatment because, as this report from UNAIDS has shown, even just a 6-month disruption in HIV treatment could cause more than 500,000 additional deaths in sub-Saharan Africa over the next year. So that's the equivalent of doubling the number of AIDS-related deaths in the region and would bring us back to 2008 mortality rates.
Certainly not good news on that one. Aisha, let's leave it there for tonight. Aisha Abdool Karim, she is with the Bhekisisa Centre for Health Journalism.